Hi everyone, it's Taya. Welcome to my channel where you'll learn the best tips and tricks on studying, productivity, and organization. As many of you know, I am a pre-med student at the University of Florida. All my pre-med students know you have to have community service, non-medical volunteering, and medical experience to apply to medical school. For my medical experience and money, I work as a certified nursing assistant or CNA. I'm always getting questions about what it's like to work as a CNA in college, so I thought it would be easier to do a whole video where I talk about all the aspects of being a CNA. So in order to become a CNA, at least in the state of Florida, you have to take a two-part exam. There's a written portion, which consists of a multiple choice exam, and there's a physical portion where you have to perform skills in front of two proctors to show that you really know what you're doing. So to prepare for the exam, you can take a course where they will teach you all the information you need for the written portion and also for the physical portion. The length of these courses will vary. I've seen some that last for an entire semester. If you're a college student, you're probably looking for a week course or shorter, and they do offer those as well. You also have the option to challenge the exam. So you learn all the information on your own and then go in and take it. I personally took a week-long course because I was super nervous about this and I didn't think I could do it on my own. It was a pretty expensive course, but it was helpful to have a physical place to go in and practice all the skills I would need to perform on the physical portion of the exam. But since I've taken the course, I always tell people that it is definitely possible to learn the skills on your own and then challenge the course. I'm actually going to link the YouTube videos that I use to review for the physical portion of the exam. I'm gonna be honest with you, it was super hard getting my first job as a CNA. I started looking during my first semester at UF, and all of the hospitals wanted you to have like 2 years of experience as a certified nursing assistant. How am I gonna get a job if no one wants to hire me? But I found that it was easier to get interviews at nursing homes, and I was eventually able to secure a job at a local nursing home. And this brings us to our next topic. I'm gonna be really honest with you. The nursing home is really hard. You do way more in the nursing home because all of your patients usually require total care, meaning that you have to do everything for all of your patients. Some days this can be 8, and on a hard day, you can have up to 14 patients. As a pre-med student, I feel like I've learned a lot more in the hospital. It's more fast-paced in the nursing home, and you also get to see a lot more than you do in the nursing home. When patients come out of surgery, I get to see their wounds, and I also get to learn a lot more about their recovery process. The most important part is getting to interact with doctors. I make sure when I meet a doctor to let them know that I am a pre-med student. And now when doctors are on the floor removing bandages, rebandaging patients, or anything along that lines, they'll come find me so that I can watch what they're doing. There are a lot of things that you expect to do as a CNA. You'll get your vital signs, which includes blood pressure, blood saturation, temperature, heart rate, and respirations. You also do the linen changes, which include changing the fitted sheet, blankets, pillowcases, etc. You do bed baths or showers, you brush teeth, you change briefs or soiled linen, and you also feed patients. I will say that feeding patients isn't as common in the hospital as it is in the nursing home, and like I said, this is because most of your patients in the nursing home require total care. I want to point out that your responsibilities can vary from facility to facility because they can give you on-the-job training. For example, when I was in the nursing home, I wasn't trained to get blood sugars, but I received on-the-job training to get blood sugars, and I now do that at the hospital. There are also a lot of unexpected responsibilities that you will have as a CNA. Coming in, I wasn't expecting to also have to clean up after patients, meaning if they want someone to come in and tidy up their room, that is your responsibility. This is more common in the nursing home, where I will spend 20-25 minutes in a patient's room at their request, cleaning and putting things away from them. This is uncommon in the hospital, but you are still expected to make the room look clean and presentable for the patient, which is totally understandable. You will also have to transport patients around. I did this a lot more in the nursing home because we didn't have people designated to transport patients, but in the hospital there are people who actually just transport patients around. But there will be times where you'll have to pack up a patient and transport them to another part of the hospital. There are also times where you'll have to sit with a patient. This happens when a patient is a danger to themselves or to others. I never did this in the nursing home, but it became more common when I got to the hospital. So this is something else you should be prepared for. As a pre-med student, or even as a nursing student, you are probably trying to figure out how to balance school and work. I will be posting an entire video on how to balance the two, but I'm just going to touch on some of the important parts here in this video. Now, I typically work 25 to 40 hours a week. This is a lot to do as a full-time student. I've been able to keep up with my 4.0 just based off of planning and being very careful in the types of jobs that I pick. When I'm applying to jobs, I always make sure I'm applying to part-time or PRN positions. I have worked part-time positions, but I found that was harder to keep up with because I couldn't make my own schedule. So when I discovered PRN positions, my life was changed. As a PRN, I can pick up any shift any day of the week as long as the hospital needs help. Prior to the pandemic, and especially during the pandemic, they always need help. So I work as much as I would like, and I can pick up on which days I want. This has been really helpful while in school, because when it gets closer to exam time, I can work less, and then after exams, I can work more. Depending on your facility, you will probably have the option to work 8-hour shifts or 12-hour shifts. When I'm in school, I usually only work 8-hour shifts, and I normally do the 7 to 3. So I'm up early, off at a good time. I can come home, shower, work out, and still have a good 5 or 6 hours in my day to get schoolwork done. But there is also an upside to working 12-hour shifts because you can work less days in the week. But once you get off that 12-hour shift, you are not going to want to do any work at all, but it is possible. So either choice works, but I would recommend the 8-hour shifts over the 12-hour shift while in school. If it's not possible for you to get a PRN position, there are still ways to make sure that you're giving yourself enough time for school and work. Jobs give you an availability form. You want to make sure that you set your availability to where you at least have 2 to 3 days throughout the week, and on those days off, you're going to dedicate yourself fully to schoolwork and any other responsibilities that you have. Additionally, at the beginning of the semester, you're going to make sure you know when all of your exams are, so you can go ahead and request time off when it gets closer to your exam. Like I said earlier, I've worked in both part-time and the PRN positions, so those strategies have worked to help me keep up with my schoolwork and make sure that I am keeping up with my grades. I also wanted to take the time to touch on the pros and cons of being a CNA. You probably always hear about the cons, so I won't spend too much time on them, but it is really hard being a CNA. You have a lot of responsibility for a lot of patients. Sometimes it can be really overwhelming, especially if you're working 12-hour shifts, but there are also really great parts to being a CNA as well. I mentioned this earlier, but I've learned a lot about the medical field as a CNA. I have the opportunity to interact with doctors, work on my patient interaction, and learn more about medical terms, jargon, and also learning how to be a part of a healthcare team. Well everyone, that's all I have for this video. If you enjoyed this video, please make sure to like, subscribe, and turn on notifications so you can get all the best tips and tricks on studying, productivity, and organization. As always, you can accomplish any dream you set your mind to as long as you give your all. And I'm here to give you the tools to make sure that you can reach your dreams. That's all. Bye everyone.